So hello everyone. Today we will explore inflammatory and infectious conditions of the musculoskeletal system, a critical area in musculoskeletal physiotherapy. These conditions differ from mechanical disorders because they involve systemic or local inflammation, immune-mediated processes, or pathogen-related tissue damage. As physiotherapists, recognizing these conditions is essential because they often present as red flags, requiring early referral and multidisciplinary management. In this section, we will focus on pathophysiology, clinical presentation, differential diagnosis, physiotherapy considerations, and clinical reasoning. So first one is classification of conditions. These conditions can be broadly divided into inflammatory conditions, non-infectious, and infectious conditions. In inflammatory conditions, examples include rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, systemic lupus erythematosus. These are typically autoimmune or immune-mediated disorders. Infectious conditions, examples include osteomyelitis, septic arthritis, tuberculosis of the spine, or port disease, soft tissue infections. Of these involve bacterial, viral, or fungal invasion of tissues. Pathophysiology. Inflammatory mechanisms. Inflammatory conditions involve immune dysregulation leading to synovial inflammation, cytokine release, example TNF alpha or IL-6, cartilage and bone destruction. These result in joint pain, swelling, progressive structural damage. So, infectious mechanisms. Infectious involve direct microbial invasion, inflammatory response, and tissue necrosis. For example, in osteomyelitis, bacteria invade bone, leading to bone destruction and systemic illness. In septic arthritis, infection within the joint can rapidly damage cartilage. Clinical presentation. Inflammatory conditions. Typical features include gradual onset, symmetrical joint involvement, morning stiffness lasting 30 to 60 minutes, systemic symptoms such as fatigue. Example, rheumatoid arthritis often affects small joints of the hands symmetrically. Infectious conditions. Red flag features include acute onset, severe pain, fever, swelling in warmth, systemic illness. Example, septic arthritis presents with intense joint pain, inability to weight bear, fever. This is a medical emergency. Red flags in clinical practice. Physiotherapists must identify red flag such as unexplained severe pain, night pain not relieved by rest, fever or systemic illness, rapid functional decline, neurological deficits. These signs indicate the need for urgent medical referral. So the next one is clinical assessment. So how is the subjective examination? Key questions include onset and progression of symptoms, presence of systemic features, history of infection or autoimmune disease. Objective examination, observation, look for swelling, redness, deformity, range of motion. Inflammatory joints often show global restriction, pain at end range. Neurological examination, important in conditions such as spinal infections, inflammatory spondyloarthropathies. Special tests may be limited due to pain. Clinical reasoning should prioritize safety over aggressive testing. So, and then we'll talk about differential diagnosis. It is crucial to distinguish between mechanical condition or inflammatory or infectious condition. So the features, if it is onset, check the gradual or activity related or acute or systemic. Pain, check for localized or diffuse or systematic. Stiffness, check for short duration or is it prolonged morning stiffness. Systemic signs, absent. In mechanical condition it should be absent, but in inflammatory and infectious condition it should be present. So this differentiation is essential for appropriate management pathways. So physiotherapy management principle, important. Physiotherapy is not the primary treatment in acute infection. Medical management is essential first. So in inflammatory conditions, physiotherapy plays a key role. Goals: reduce pain, maintain joint mobility, improve function, and prevent deformity. So interventions, exercise therapy includes range of motion exercises, strengthening, aerobic conditioning. Joint protection strategies. Patients are educated to reduce joint stress, modify activities. Postural and functional training, especially important in ankylosing spondylitis and spinal involvement. In infectious conditions, acute phase, rest and immobilization, medical treatment, antibiotics or surgery. Rehabilitation phase, once medically stable, gradual mobilization, strengthening, functional retraining. Role of physiotherapist in multidisciplinary care. Our physiotherapists work alongside doctors, rheumatologists, infectious disease specialists, surgeons. Key responsibilities include early recognition of red flags, safe rehabilitation, long-term functional management. Clinical reasoning example: consider a patient presenting with severe knee pain, swelling, fever, inability to weight bear. This presentation suggests septic arthritis rather than a mechanical injury. Clinical decision: immediate referral for medical evaluation, avoid aggressive physiotherapy. Another example: patient with bilateral hand pain, prolonged morning stiffness, fatigue. This suggests rheumatoid arthritis. Management includes referral for diagnosis, physiotherapy for joint protection and function. Long term implications: without proper management, these conditions may lead to joint destruction or deformities or disability, reduced quality of life. So early intervention improves long-term outcomes significantly. So what are the key take-home points? So inflammatory and infectious conditions differ from mechanical MSK disorders. Red flag identification is critical. Physiotherapy plays a supportive but essential role. Multidisciplinary management is required. So the thing is, inflammatory and infectious neuromusculoskeletal condition remind us that not all pain is mechanical. As physiotherapists, our ability to recognize red flags and make appropriate clinical decisions is essential for patient safety and optimal outcomes. So thank you for joining this advanced discussion, and I will continue sharing more high-level musculoskeletal physiotherapy topics in the coming next videos. So see you then.